Weight Watchers CEO has recently come out indicating a radical shift in the approach the company is going to take in helping its clients to lose weight. Whereas historically they've been very focused on behavior change, on in-person and group interaction, on changing behavior, diet, exercise, and so forth. They have now moved fully into embracing the new weight loss drugs, the Wegovys, the Ozempics, Zepbound, and so forth. And they've even gone as far as to acquire a telemedicine company to be able to prescribe these medications directly to their clients, so they don't even need a physician or somebody else to do that for them. Now, I'm a physician myself. I prescribe these medications routinely to a lot of my patients with diabetes, with obesity, or both. So I'm not here to trash them, but I think a word of caution is very necessary at this point, because this is not just Weight Watchers. This is an industry-wide shift that we're witnessing, where people are moving from making money from writing books, promoting diets and programs along the lines of behavior modification into pharmacological products. And everybody wants a piece of this pie. And I totally understand that. But let's remember that we've had these drugs for just a few years, and we don't know what the long-term effects are, really. We just don't have data to say for sure that in 5 or 10 and 20 years nothing unexpected and significantly bad will happen. But that aside, I think there is a more fundamental issue that I see among a lot of my patients and in the society at large when it comes to these medications. Unfortunately, a large group of people seeking these medications see them as the fountain of youth. Give me these medications and this is going to solve my obesity or excessive weight problem. And again, as a healthcare practitioner, I'm well aware of the genetic factors that play into somebody's excessive weight. Those are, unfortunately, for the most part, outside of our immediate control. I'm well aware of hormonal factors that play into this. But let's not forget that even the producers of these new weight loss drugs are very keen to say that they should be used in conjunction with a good lifestyle, with diet, exercise, behavior modification. So they are part of this whole package. Unfortunately, we humans are very vulnerable to simplistic solutions to complex problems. Just take this one thing and your problem will go away. The other part of this is a lot of patients are not aware of the potential known side effects of these medications. I've had many patients who have tried Mounjaro or even Ozempic, and after 2 or 3 months of titrating the dose up, or even sooner in some cases, they come back and say, "Doc, listen, I can't take this nausea, I can't take this diarrhea, take me off of this thing." So it does not work for everybody, and you guys have to be aware of that. So what's my prediction as to where this will eventually go? I think there's a bubble coming up and everybody's going to rush for the piece of the pie of these drugs. And then as time goes on, we're going to become more aware of their limitations, including their side effects, some of which I mentioned, of the fact that the story is much bigger than pushing this lever on which these medications act. And ultimately, we're going to find ourselves in the position where we will once again recognize the necessity of regular physical activity, of a healthy diet, and of a healthy lifestyle in general. Will there be a permanent place for these medications in a lot of people's lives? Most likely. But just like in high blood pressure, you don't solve the problem just by taking a blood pressure drug. Even more so in excessive weight and obesity. It's not going to be as simple as taking a drug in the morning and then all day long and all the rest of your life, you're going to be able to enjoy the same highly processed, high-calorie foods and be a couch potato. That's not going to happen. I'm Dr. Gili. Let me know in the comment section what you think about this issue. I'm open to discussion here. This is just my opinion. And until next time, you stay healthy and you stay slim, my friend.